Welcome to the Weekend Wellness Hour. Today I have a special guest, Dr. Kathleen Rickard, who I met a couple months ago through a mutual friend, part of a group of healthcare practitioners in the Arizona state, Phoenix area, who are all looking to help and teach each other, help each other grow. And so I met Dr. Rickard, and she is a nurse practitioner, family nurse practitioner. She has 23 years of experience as a nurse practitioner and then 35 years of experience as a registered nurse. And she speaks around the country on various topics regarding health and wellness. She studies a lot about chakras and how energy flows around us and how that can create emotional blocks. So we're having her on today to join us and to bring to us her information that can help us with our overall wellness. So thank you for joining us today, Dr. Rickard. Welcome.
Well, thank you very much, Amy, for having me. I appreciate this. This is one of my favorite topics of all because I will tell you that as a nurse practitioner, I'm very well trained and I very much understand the medical world and the Western medicine as I've been trained. My background is the ER, so I'm very versed in life, death, and everything in trauma and everything in between. What I found over the course of my time as a nurse practitioner, well, as an RN too, but as a nurse practitioner, is that if we could find a way to access what's happening with our energy, what we're finding with our emotions, what's going on that makes the body run into trouble. I first noticed it when I was an RN in the neuro ICU, actually, and on the floors, and I noticed that I would get a series of the same kind of patients. Like I would have 5 chest tubes this week, or I'd have 6 gout that week, or I'd have gallstones that week. And I noticed that it would seem the things seem to come in groups, and I never understood what that was. As I've learned over time, that is one of the concepts that I just kept building on to teach myself and then teach my patients that we are collective and we are all energy beings, and then our energy of our emotions and our feelings play a big part in how our body is and what is happening with what we call dis-ease. So when I started to evolve more into that, I realized that we have that we're really energy bodies. We are a very on the very cellular part of ourselves. We have our DNA, we have our mitochondria, we have our protons, neutrons, and all that. But it's even deeper than that, that in an energetic quantum physics perspective, we actually are energy beings that work in a collective consciousness of other energy beings around us. And that's not just humans, that's the earth, that's the planets, if you will. We're all just a kind of a collective understanding.
Yeah.
And I developed I'm sorry?
And I know that we are used to seeing energy, like in terms of light energy. So we're used to hearing sound energy, but what you're talking about is different, right?
Right. Sound energy is part of it because it's part of what's called vibration. So we hear and we don't hear things. So in the realm of, let's say, medicine, we know that an MRI is an energy exchange. We know that. We know that changes within the system to show us our organs and our bodies. And we knew that from an X-ray, really, back in the earlier days. It's just change in energy that way. And we also know that that's what our phones are doing. We don't even question why our phones are working, but they do. It's all this magic. So we live in this magical physics world. We have it all around us. If you look on your phone, you'll see 25 people with Wi-Fi right next to you. That's all energy that's part of our world. And then we're getting the 5G concept, and we're going to have this 5G, which is really quite a lot of energy in that way. So in those days, that in the earlier days, way before 5G, and I barely had a cell phone and I barely used a computer, but I understood that by accessing some of our information, we can ask a question in different ways than just Western medicine. because Western medicine can understand a diagnosis, and this is how they work on things, but then they take a pill for that and modify the diagnosis. But what if the diagnosis is only a part of the emotional and spiritual and energetic system in a conversation with the person involved? So that so there's been a history of a thing, let's say, of meridians. Meridians are another energetic field. There's a system of an auric field. We all know that we can hear somebody coming up behind us and they didn't make a sound. We feel
Mhm.
that because we have this egg bubble around us called an auric field. The
Okay.
Eastern Indians knew it. The Western Indians knew it. The Africans have it. Everybody has an understanding, and but they've been put into a realm of spirituality and even religion, when in fact it's just part of our attachment to the collective. We can call the collective whatever we want.
And I think that's a big point that you're making there, that sometimes when we hear someone talk about energy, we think just woo woo or spiritual stuff. We don't think about anything related to as much related to science and actual chemicals or changes in atoms and what's going on around us. So I think what you're talking about is it's good to also tie it back into physics and, what's really happening with energy, because physics is a study of different types of energy and how it moves. So this is part of that.
It is very much part of it. And in fact, they talk about waves and particles, and they go on and into that realm. And anybody that's worked in any of the mediums that look at like Tai Chi, for instance, and the Chi ball, understanding that we have all that. We have this cushion all around us, in and out of us, and we can use our hands to actually feel that. And they talk about that in different Tai Chi and Qigong kind of concepts, and it's been known forever. And we're starting to get closer to understanding that, and people are becoming more aware. So the whole idea of energy medicine in general is to have an opportunity to be aware of what your body wants to talk about, because our physical body isn't the everything. So if we took a pill for that, it's not the everything. So it could change the symptoms, but it's not changing the disease. Metformin changes the symptoms of a blood sugar, but it doesn't change the disease or
Right.
dis-ease or the process. So
Yeah.
then we need to understand that we're getting more sensitive to appreciating that, and now we're getting the energy medicine realm is becoming more understood over time.
Right. And so now we hear the word chakra a lot. You hear it if you do yoga, any type of guided meditation, if you go see an energy healer. I know chiropractors that do it. So can you start from the basics? What are chakras? What does that mean? And let's
Okay.
dive into it.
All right. So as a concept of chakras themselves, they've had it's been known. Literally, that used to be spelled Chakra, chakra. It's in Indian Sanskrit. Sanskrit is the first language of humans, is Sanskrit, and Gurmukhi is actually the name of it. But it was found there. It was found in Africa. It's been found everywhere. Chakras basically are swirls, let's say, or fields of an energy in a kind of a circular, I don't know, or vortexy looking behavior along our spine. It's been found in the plexus. They've actually found energy changes in neonates, because they can see the spine, and they can see those changes in it, and they find it in the nerve gap junction. So it's called neonatal nerve gap junction sites.
Mhm.
They think that's the beginning of it, and it's part of our spinal process and our nervous system, really. But
Okay.
it's a little different than that. So it's a little bit harder to touch, although they now have more information on how to do that. So the idea of chakras as a concept, and it's only one of many energy worlds. The chakras have different theories. The older ones say there were 7. So the basic 7 is what most people learn about first.
Mhm.
And it comes from the basic area about like the first one is around the root area, which is like the coccyx and that kind of an area.
And if you
It's
don't know what the coccyx is,
Oh, and the tailbone,
thank you.
sorry, and down
That's okay.
around real low into the upper legs in there. The next area is around the pelvic area. That's the second. The third is around the solar plexus, and the solar plexus is the mid-abdomen area, if you will. The fourth one is around the heart area, lung area, the spleen, those areas. The fifth one is considered around the throat area. The sixth one is in the third, what they would call the third eye, but it's really part of the pineal gland up in the brain with the hypothalamus and the pituitary. And the seventh one is just above that, and they say that one's the connection to higher spirit. There's been a lot of fear about that's scary, and a lot of religions get worried about that, but the energy is just a flow in that way. It's not frightening, it's just tools. It's helpful tools to know who we are as human beings among the collective of others.
Okay. So can we dive into each of those? So if we start at the root. So down by our tailbone. So what does that area of energy, what does that tell us? Like if you're blocked, I hear the word your chakras blocked down there. People hear that. So can you dive into what does that mean and kind of go through each of the levels?
Okay. This is very beginning information. I
Mhm.
use it less and less in practice. I use more about how to communicate and ask the person where they feel a thing.
Mhm.
But in the beginning of understanding it, and I'll also just tell you there's another system that's 12, which includes down to
Okay.
the ground and up and around, and there's hands and all those. So, but with the basic 7, the
Mhm.
first one is considered the color red, and that color is just part of a visualization to help more of your senses understand it. But the root has to do with the universal knowing, basically, the groundedness of knowing that we're all one, that we're all part of the universe, we're part of the earth, we're part of the bugs and the trees and the plants and all those things that are around us. And it's a basic concept of that. In a block of that, in the true sense, although things are very mobile, in the true sense of that, a block of that can give you some symptoms of, let's say, hemorrhoids, or in the worst case scenario, a cancer of the colon in some cases, because you're not feeling connected to the humanness of who we are on the planet. In that, but it's a little different. It's been evolving into much bigger than what I'm saying now, though. The second one is about the is considered the water area, and it's considered a color of orange, and it's like the rainbow in this way. And the orange, or the water, or the second chakra, has to do with the bladder and the uterus and the genital organs, and
Mhm.
it's related to creativity and procreation, but in a creative procreation concept in that way. And
Okay.
blocks in that way can give us all kinds of female issues, male issues. If we're not feeling the creativity of our life, and we're not having any passion in our life that way, sometimes we will represent into that concept there.
Okay.
The the third one is related to the solar plexus area. It's actually our vocal voice. So you'll hear it from, like, singers will say you have to come from the belly in order to get your voice projected,
Mhm.
because this is the place of insecurity and safety, actually. And it has and it's considered the color yellow, although you'll see this all different, I'll just tell you. But you'll find that people that have a lot of fear in their lives will get, that's where ulcers are, that's where the gut feeling of life is. We know these things in some kind of way, but those are the areas that you'll kind of, you'll know it, you'll have food allergies.
Yeah.
It's a safety issue, and we have that kind of a problem.
Yeah.
In the fourth area is around the lungs and the heart. And that one is considered in the concerned area or the blocked area is a mourning or loss or sadness, and we just haven't been able to work our way out of it. Finding joy and peace and opening up that area is actually quite huge in being able to stand erect and stand in our power and have our strength around us in that way.
Okay.
It's considered green. And then the next color or the next chakra is in the throat chakra. And this one is considered a different kind of voice. The voice of the belly is the power voice. The voice of the throat has to do with our strength in our internal voice. So our knowing of things. Can we surrender to the knowledge? Can we be balanced in our care? Do we take care of ourselves in that way? And I think this is a major player right now in our voices. So many hypothyroid problems because I think we choke ourselves and we live in a cubicle and we don't, speak that internal spiritual voice that we are as entities. The next one is consider the third eye or the hypothalamus. It's very regulatory of the hormones. It's part of our whole endocrine system and our understanding of the world around us. It's considered our inner knowing in that it's our connection to beginning connection into spirituality in that way.
Okay.
Then the seventh chakra is related to our connection to everything. So it has our connection to our higher power, as you wish, whatever that looks like to you. Even if you're atheist, that's not the problem. It's what the connection is to ask advice and be able to work through all the rest of those. That's the down and dirty.
Well, that's great. I mean, it helps because you often hear, oh, your heart chakra is off, your solar plexus is off. So it's good to know a little bit of information, and this just gives us some background so we can relate it to ourselves, our experiences, if we're not feeling well, what we're fearful of, that, anxiety we have in us. It's great to say, oh, okay, well, I can see where is my blockage? Where is the energy not flowing? So now you as an energy healer, a practitioner, what do you experience? Let's say someone walks into your office and they're not feeling well. Like, what do you feel or how do you approach it?
I'll give a story first, and then I'll tell you what my day by day is like. The story that I use pretty classically, and this helped me cement it really well, is that I had a patient as an example. So in medicine, we do case studies. So I'm just giving you a case study as I would, anybody in the medical world. So here's a case study. She was about a 50-year-old female with two children, 10 and no, they were teenagers, two teenage children, married. And she came in with chest pain. And it was this horrible chest pain. She was sure she was going to die. It was just terrible pain. And she's in my private practice. So before, it's like just shy of, is this an emergency or do I need to send her to the ER? What do I need to do with all this stuff? But in my world, I ask a question. So I just say, okay, let's just breathe through this. I want to do an EKG. I want to do things that'll make sense. We want to do some labs, but I wanted to ask you a question, and I want you to just, what's the first thing that comes to your mind? Is there anything that you're feeling that has a sense of really, really fast traumatic loss, something lost? And she goes, no, my life is perfect. And I said, okay, that's fine. Then let me do all these things. But there's usually has something attached to it that we can at least address and be at peace with while we're doing the rest of the stuff. So I'm not ignoring you.
Yeah.
Her response was, oh, by the way, a coyote came over the fence and took my two dogs a few weeks ago. And I went, whoa, time out. Let me ask you about that. What do you think about that? And she goes, well, everybody tells me it's nothing because I have two healthy kids and there's nothing about that. And I said, well, how old were your dogs? And she told me the age of the dogs, and the dogs were older than her children, right? And I said, well, did it occur to you that those are lovely beings? You love them to death before your children. They are lovely human beings to you. And she goes, well, yeah, but I don't know that. Yeah, I do. And it was like this. And then she started crying. She started calling, settling into that. Not that I'm asking for people to be crying, but
Yeah,
that's helpful to understand and see where the root is. And I said, okay, so I want you to take some deep breaths and I want to do the EKG, but I want you to understand you need to grieve fully in this thing and don't harbor it in one place. And go get the collar and keep it in a safe place for a little while, and just say, I'm so sorry for you. I'm so sorry. And understand that they're equal entities to every other energy that you have, and maybe even more because they were around before your own children. So I said, okay, so the EKG was normal, the labs were normal. I sent her off to the cardiology, but she didn't go. She came back to see me to talk about the labs about a week later, and she goes, I don't need a cardiologist. I get it. I'm done. And I have that worked out.
that's
And I went,
awesome.
oh. So that began a really amazing story in my mind that I can use those tools as a conversation. I
Mhm.
don't rely on chakras as the end all be all. So if they have a vision of red, they're not, well, I'm not talking about their root chakra today. But
Yeah.
what I will do is when the body has a question, I'll say, let's ask the body what it wants. I do some work that's listening. So I just ask in my own way. And I also look at what their concern is.
Mhm.
I'm having so much trouble with my pelvic floor. And it's because, well, for other reasons, not to be in details, but it's just a lot of female problems that happen in that way. Let's
Yep.
just use that.
Yeah.
And so we will have a conversation that includes things that would be considered an algorithm to do. We need to do urine test and, things like that, pelvic exam. But I will also say, I want you to just speak quietly into that space. And is there a thing about relationships that are kind of an issue? I mean, it doesn't mean they're big. It doesn't mean you have to change them, but knowing them helps you use your own body to say, all right, I hear you. And it says, and it always works. It always works. And it doesn't mean that it's their husband and they have to have a divorce. Whatever. But you know what? They say, you know what? My boss is really pissing me off. And I said, interesting word, pissed off. So as you have a bladder infection, does that
Yeah.
work? Because words and sound vibration are energy, just like all the others. And
Yeah.
so I ask those kind of questions. And then I do the things that I need to do. Sometimes I don't need to do anything. And
Mhm.
sometimes I just need to get them to move through space, or they need a chiropractor, a physical therapist, or they need somebody else that is able to delve more deeply into that particular body part. But I
Mhm.
find that the body part down here isn't really related to as much disease if we catch it early. So
Right.
what I tell patients all the time, what I tell everybody all the time is go within quietly, come from this higher area and just come down your spine a little bit, go up and down and do an assessment periodically and say, yeah, I'm a little icky right here today. Well, did I eat something funny in my, is this really my stomach, or is my third chakra saying I'm just tired right now?
Mhm.
So in these days with all the issues with COVID and all the
Yeah.
problems that we're having, we're so stressed and our bodies are just on fire. And it's showing up in not functioning, not tolerating foods very well, or habitually eating really junk food just to soothe it.
Mhm.
Are we doing that? And is that if you have the knowledge of that, could that maybe make a difference on what you're doing on a conscious level every single day? And I'm a big fan of breathing through. So if you just breathe in and feel all the way down and all the way up, and just say, how's my assessment today? I'm doing pretty good. Do I
Mhm.
feel it right here? Am I tense right here? Do I need to speak my own knowing a little bit better? Do I need to take a moment? And that's where we get our information. So I use it very much within the regular allopathic world, but
Okay.
I'm very much using it as a healing modality that is far superior than just doing an x-ray.
Yeah. And a lot of times getting the X-ray, the MRI, the CAT scan brings a sense of comfort because we have a fear of the unknown. So having something that shows a picture of our insides often brings people a comfort, even if it's not always accurate, because we know those scans are not 100% accurate, but it still gives us some information on what our body looks like on the inside. And then it can go along with helping when you're dealing with energy and blockages and so forth?
As people get better and better with their own healing, because what I'm really doing is I'm teaching them how to access themselves.
Yeah.
Because energetically, this isn't about me putting some power on them. No, 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 no.
Mhm.
This is about me asking them to ask their own body what to do, and can they assess that? And sometimes the MRIs are not necessary. Sometimes that fear says, I need all the tools I can get to be okay in the world, and then we'll have a chat. I don't have a problem with that.
Yeah.
I'm carte blanche. If you think you really need an MRI, let me write for it right now, because
Yep.
I can't release a block if there's already a paradigm.
Yeah.
But I'm finding in this time that I have more and more patients that understand. They're starting to get it. Go, okay, I get it. I still want to check this out, but I get it. Let me just be quiet and get a moment in it. And what has this year 2020 given us but moments of silence? What an amazing wild world that is.
Yep.
And so here we have an opportunity to make that shift in that way.
Yeah, and it's great. And so as you assess someone and you're having them ask questions, where do you feel kind of just unsettled or uneasy? Do people feel a shift right away? Does it take a week, a day, a month? What do people feel and what are some of the results?
My doctoral work and my doctoral dissertation, as it were, was on breathing techniques for physical health outcomes. As
Mhm.
goofy as that sounds, it turned
Yeah.
out to be quite robust.
Mhm.
What I found in that study is that if you can get them to be quiet enough, first of all, everything kind of just hits that fight or flight mechanism down. So breathing techniques from the diaphragm, which works on all of the chakras. Actually, it's not selective, but I use that a lot to say, let's just take a deep breath and
Mhm.
see if we can calm the nervous system down. If we can calm that nervous system down long enough to hear, then we are able to listen better.
Yeah.
And so I use that tool a lot. No one leaves the office without doing a breathing technique. Whether I can spend 25 minutes with them. Honestly, some people cannot get that diaphragm to go down, but some people are go, okay, let me drop in, and that's a drop in, and it requires that. So do they feel better? If they can understand that they have control over anything, that is
Yeah.
huge for anxiety. So
Yeah.
yeah, they leave with tools and they get it. Does it mean they need to keep looking? Sometimes. And sometimes they go, well, let me just get a little blood work and I'll see. Let me just see. Give me some time. I'll write out the notation for them to get their MRI or whatever. And I said, give yourself a day and feel that, and feel if your body can feel its own balance, and if you need it. If you need it, you need it.
Yeah. And I imagine, I don't know if you do this or not, but I imagine you could do this virtually as well, especially if you're not putting your hands on people, but if you're teaching them how to assess their own energy and the different spots, you could possibly do this virtually as well, right?
Well, actually, absolutely, 100%.
Mhm.
And the reason is because we are a community. And if we
Right.
have a connection, even if, so I do Reiki work too,
Okay.
and they do long distance Reiki. So I was trained that a long time ago. I don't use those tools as much as I just use energy. I just ask to facilitate energy. So I
Mhm.
ask, where do you feel like this is a problem? And we work together on that. So yes, virtually works very well, because what is quantum physics but particles and waves, and actually energy in long distance works super well. I did training in a thing called reconnections with Eric Pearl. If anybody looks
Mhm.
that up,
Yeah.
Eric Pearl is like the king of all that stuff. He says, oh heck yeah, it goes right through. He will do online energy healing, and I had him work on me one time. I could feel like electrical pulses all the way through my body as I was laying there going, wow, that's weird. It just came and then it went. It was when he
Mhm.
was on and when he was not on. It was
Wow.
amazing. So yes, long distance is no difference. There's no difference in time and space according to quantum physics.
That's fascinating. So now, when you see someone and someone walks into your office, do you have an idea based on how they're moving, kind of where they're blocked, or do you get it more from the conversation you have after they've spent some time with you, or is it something that just shows up in their kind of their aura when they walk in?
Um, so someone walks in the room.
Mhm.
I don't really ask a lot of questions in the beginning. I first,
Mhm.
when I'm doing the healing work, I first say, let me just ask your body a question or two,
Yeah.
and then just see what's going on. And I said, and then it'll show me some kind of a pressure area, and I'll go,
Okay.
okay, well, that's interesting. So, what brings you here today? What am I doing? How am I helping you
Mhm.
today? And
Okay.
they'll tell me whatever the symptoms are, because that's what they know to
Right.
start. And I said, all right, well, let's investigate that. And so I'll do work that, and when in the office, I'll do manual work to just ask that question.
Mhm.
Sometimes I don't. Sometimes it's all verbal, and they just want to know why their body's like screaming at them right now.
Yeah. So what are the some of the things that this impacts, like orthopedic pain, organ issues, actual, syndromes or conditions or diseases? Like, what are some of the things that you have seen shift towards the healing aspect when you just deal with chakras and freeing up energy blockage?
What what actually happens the most, honestly, is what I believe is that the physical body is a conduit. It's a messenger. So
Hmm.
in truth, when I do my work, it's often an emotional, energetic release. So when they are calmer and they feel better, those pains aren't as noisy, because
Yeah.
that's not they it was trying to talk to them in the first place. So what I usually find is that, and I know for sure, we're all connected. We're connected with our mind and our body and our spirit and our physical and our emotions. So if we kind of take a look at from the emotional part, which is so connected to our endocrine system anyway, it's all this fight
Hmm.
or flight in the autonomic nervous system. It's very much ready to protect us. And if we feel like we're protected and they feel safe with me or whatever, then their body can take a little relaxation, and we can work on physical things. But we need to know where they stand in their protection, which is their emotional
Hmm.
body.
Okay. So it can help many conditions, many people in all aspects of disease or health, either way.
Yes.
So,
Yeah. And I put a lot of energy in understanding and helping them understand that the medications they take, I'm not necessarily robbing them of that. I'm just
mhm,
but I can tell them that if their body was in better ease and better balance, their number of medications or their medications in general could be decreased significantly.
yeah.
But we also talk about nutrition, because we don't have a good, clean ground any. It's hard to find good
Mhm,
earth. So
yeah,
there's also real things to talk about that way too.
that makes sense. This is wonderful. Is there any other last thing that you want to discuss regarding energy or chakras? Any last bits of advice?
I think that the best thing that I can tell anybody to do is just ask the question without fear. Just say,
Mhm,
okay, body, why are you having this conversation with me? And why is it getting louder? Why am I getting headaches? And why is it getting louder? Take a breath, go inside and out. Use the chakra idea to say, well, in this area, sometimes it's about this. So let me just ask, if it's all about the head, am I just thinking too much and I'm not taking time for myself? Am I
mhm.
not getting enough rest? Is it actually a structural problem? Is it really all that and I need a massage? Do I or what? Do I need more water? Just ask the question, and really your body, all it has ever wanted to do is tell you how to keep the rest of your bodies together. It's only the story. And
Yeah.
when it gets too loud, it becomes a dis-ease, and when it gets too loud, then it becomes chronic.
Absolutely. That makes sense. And we appreciate any tips just to help us, one little bit of information that we can just incorporate. And one of the reasons we have this Weekend Wellness Hour show is to bring people's attention back to their health on the weekends, because a lot of times we'll push hard Monday through Friday. We have a regimen, but then weekend comes and everything just goes to the wind. So it's nice to have conversations like this that we can assess ourselves. We can take what you just said and start to implement it to learn more about our bodies and become more aware of how we feel and what we can sense.
Yep, and that's what it's been wanting all along.
Yeah.
So, yep.
Absolutely. So how can people reach you?
So I work at Essential Family Health and Wellness.
Mhm.
It's on 74th Street and Shea.
And that's in
And
Phoenix.
we use insurance there, and it's called a healing, which is different than your regular visit. And we use an extended, um, we use the extended billing to make it okay. So it actually works with many insurances. My website is healgracefully.com. It's all one word, HEALGRACEFULLY. And you can contact me there if you would like to. In the before 2020, I was doing work out of my home also. So I can still do that, or I can meet you after hours at the office if you'd like that. So
And
you can
that's
find
in,
Essential Family Health and Wellness on my Heal Gracefully site as well.
and that's in Phoenix. So we have an international audience here. So we're just
Oh,
gonna
I'm
let them
sorry.
know
Yeah,
Phoenix,
Essential
Arizona.
Family Health is in Scottsdale, and
Scottsdale.
I'm in Phoenix. Yes.
Okay, just want to make sure because we have
Sorry.
listeners all over and they don't know the address. So
Yeah, the
that's
map
all.
will be on. The map is actually on my website. So
Yeah, and which is one of the reasons why virtual is important now too. They can contact you and reach out to you if they want to talk to you virtually and kind of
Yep,
get some advice.
I actually see patients like that. I'm on a board member for Eric's House, which is
Mhm.
survivors of those who have died from trauma, the survivors of
Yeah.
those.
Yeah.
And I do Zoom conversations, and we work through that online. Zoom works really well that way.
That's wonderful. So thank you for joining us today. We really appreciate you sharing all of your knowledge, the ways that you approach helping others. It's amazing. So I just want to thank you for joining us.
Thank you, Amy. I really appreciate being invited. I
No
appreciate it.
problem.
Thanks.
No problem. And thank you all for watching the Weekend Wellness Hour show with us today. We will catch you guys again next weekend to bring you again back to your health on the weekend where we tend to fall off the wagon. So let's join us again next weekend. Have a great rest of your weekend. Take care. Bye guys.